All right, let's rock and roll. Good morning. This is Lyle Hanna coming to you from the Hanna Resource Group. Welcome and thank you for joining us for Crisis Management for COVID-19, week 37. Can you believe it? The year's almost over, but we've got some great things to share with you today. I'm monitoring the TV news, as I suspect a lot of you all are, and they say they're going to vote on this thing. A lot's happened over the last 2 weeks, though. Actually, most of it happened since Friday or towards the end of the week. But our special guests are our team this week. Nobody from the outside particularly. We've got Jim Morris, whom people seem to love and keep signing on for. He has been working diligently overnight last night to pull together some great information for us. And then we've got the HRG team that are going to give us some highlight of things that have happened, the best of things that we've shared with you that are still relevant, because boy, a lot of things we shared with you were really hot on target when we shared them, but a lot's changed over time. So just a little update from last week. You know, we had Dr. Keith Knapp on, and he's part of the team that's in charge of the vaccines in the state of Kentucky, and he says we've received 38,000 of them, and those have been distributed and given to people now. You see a lot of that on TV. But when you count the number that we have set for the first wave, that would be first responders, people in the hospitals that are dealing with patients and so forth, and all the people in the nursing homes who are being the worst, suffering the worst from this. Over 60% of our deaths are people still in, older ages in nursing homes. There are 51,000 of them. So we have 38,000 doses, 51,000 people that need them. So we're counting on more to come in from Moderna this week, and they look like they're going to happen. So we're going to try to get on top of this whole thing, but still moving forward. All right, Jim, welcome. Good to see you. You're still wearing that T-shirt on the beach. I know you're wishing it was still warm out there. It's positive thinking, which is what
I wish I was at the beach.
Same here. So tell us what's going on. EEOC, vaccines, small business relief, national and Kentucky updates. You've got a lot to share. Take it away.
Whole lot of things going on. I'm not even sure whether my slides have kept up with things because I've tried to make changes as we go. So here goes. So this is the Kentucky update. Basically, we're going to stay red for. If you're interested in the travel ban, the travel advisory, they've changed how they do things because Kentucky got up above 15%. So we all of a sudden announced, I didn't put this on the screen, but the state announced that it was no longer going to follow the Johns Hopkins percent of positive testing. Now we've gone to a different calculation. Not really sure what it means yet, but right now we are one of the areas that if you followed our guidance, you can't go to Kentucky. So there's that. So this is the White House update. I'm putting this on there simply because it's the most up-to-date information with regard to where we are nationally and what we're doing. So I thought I would add or point out to you where we are. Whoops. We're at 513 cases per 100,000. That to me is the best way to calculate. It's not based on the percent of positives because that depends on who's being tested, how often they're being tested, and so on. So we're at 513. We were at 344. We're the 22nd highest state. We were 24th before. And according to the White House, we're at 10.1% positivity rate. Johns Hopkins has us at around 16%. We're stable with new cases, decrease in test positivity. We were previously increasing in both the counties. If you're interested in where we are with the number of counties and so on, it's all there. I'm not going to waste the time on it. This last one is what you should be concerned about. Hospitals are reporting critical staffing shortages. They're not yet reporting any ventilator shortages, but that's probably what will be happening next. So that's the issue from the White House. Make sure I didn't skip a screen. Yep, all right. So, sorry. Two different orders came out from Governor Beshear. These are both executive orders under his privilege granted by the legislature, as well as the court weighing in and saying he could do what he wanted to do. So 996 is a mask mandate, and it basically, this was on December the 3rd. It basically is, if you are in a facility, if you're waiting in line to go into a facility, if you're waiting in line to get on public transportation, wherever you are, you're required to have a mask on anytime that you may not be able to social distance. That is all interior, including gyms and fitness facilities right here. And then also everything outside, if you cannot socially distance, you're still required to also wear a mask. This expires on January 2nd. I don't think that's by surprise or by mistake that it's the day after New Year's so that they can enforce this throughout the holidays. Then they came out on the 11th with one that took effect on the 14th. There is a typographical error. I don't know that I put that on here. No, there is a typographical error in the order. I'm not sure. They reference an order that does not exist. It says 989, and I believe it was supposed to be the 869, but which was the previous order about restaurants and so on with no indoor. This new order is a little interesting because it really didn't do anything except have recommendations about 2 households, 8 people, no longer forcing it, no longer mandating anything about restaurants. There is a kind of an inherent threat in there that if things don't continue to trend better, he'll just shut things back down, but it doesn't say that. Mass gatherings order is the one that's been lifted because this one is more stringent with its recommendations. Again, it's not an order forcing anything, but 2 households or 8 people. So I have a neighbor down the street that has more than 8 people that live in the house, and I've wondered how it's constitutional, but nobody has challenged it yet. Social distancing and hygiene mandates still are in place, so keep that in mind. Now, 2 weeks ago we talked about the 2 weeks ago we talked about the vaccine, and I had told you what my thoughts were on whether you could enforce vaccine as an employer. And now the EEOC has basically come in and said, yes, Jim Morris is correct. They didn't say that, but they basically spelled out everything that I told you 2 weeks ago, and they put it into frequently asked questions. So if you'll go back in time, we're going to talk about that here in a minute with the HANA resource team. I went down through all of the different requirements that were in the EEOC. Every time they had a new frequently asked question, we had a whole segment that we ran in this meeting where we would tell you what was going on. All of these are brand new sections or in a brand new section of that frequently asked document. I have attempted to pull this up so you could look at it. The EEOC website apparently has been hacked, I know, this morning by somebody called Drupal 9.0.8, so I cannot show you what's going on the EEOC website. The Russians are coming, so that's the website right now is down. There's no way for me to share it with you. Luckily, I copied everything last night, put it on here so you can see it. So here we go. EEOC has come in and said, in answer to these, now some of these are summaries that I've thrown on there because why write out the whole question when it's pretty simple? So, is administration of a vaccine by an employer a medical examination? The answer is no. If a vaccine is administered by an employee to an employee by an employer or through a contract with a third party, so for example, if you contract with First Care and you go to them and you have them administering this as part of your employment package, you are allowed to do that. It is not a medical examination. However, if you administer or contract for the vaccine, you must also show that any inquiries that you have into the vaccine questions are, quote, job-related and consistent with business necessity. You're going to see here in a minute, I think that they put these in the wrong order. I went K1, K2, K4, I'm sorry, K3, K4. I skipped to K9. I came back to 7 and 8. But you're going to see here in a minute, they basically say you may not want to be giving these tests yourself, and you'll see why. So K2, the question is, if an employer requires an employee to receive a vaccine and asks required pre-screening questions, are those questions subject to ADA standards? And the answer is yes. So this is where it starts to get a little bit dicey. If you're the one administering this vaccine or you've paid for someone else to do it, there are pre-screening questions. Do you have allergies? Do you have a familial relation with, or familial issue with regard to hives, with regard to certain reactions, and so on? Those questions are indeed protected. Now, they put down here two, and I put this in red for a reason. There are two exceptions. And let me go back up for just a second. EEO laws, this is a direct quote. EEO laws do not interfere with or prevent employers from following CDC or other federal, state, or local public health authorities' guidelines and suggestions. Well, CDC is suggesting people get the vaccine. So the EEOC has come out with this great and wonderful declaration at the beginning saying, follow the CDC and you're good to go. But wait, they then come down, and this exception at the bottom is very important. It talks about volunteer vaccine denial, meaning if you voluntarily offer a vaccine and your employee refuses to take it, that's fine, and you don't have to answer questions. You don't have to ask them questions. But if they deny it or they decide not to take the vaccine, you can't retaliate against them if it's a voluntary procedure. Or if it's a third party with no employer contract, i.e. CVS Pharmacy, Rite Aid, any other pharmacy, First Health, whatever you're going to, if you are not involved, if you have not signed a contract, then you have no problem with any of these tests. If you are involved in these pre-screening, number one, the pre-screening questions have to be job-related and consistent with business necessity. Number two, if the employee does not answer questions and does not receive a vaccine, you have to demonstrate that that employee will, quote, pose a direct threat to the health or safety of her or himself or others. Now then we'll talk a little bit below about the direct threat. Again, if you're not involved, you don't have to worry about these questions. So let me jump forward. Number three is asking or requiring proof of receipt of the vaccine a disability-related inquiry. The answer is no. As long as all you're doing is saying, did you get the vaccine? Can you show us you got the vaccine? Do you have proof of the vaccine? However, if you then follow up this bold part here, if you ask, well, why didn't you get it? Well, what's the problem? You may elicit information related to a disability. For example, well, I didn't get it because my family has a history of hives. That's a GINA violation. You cannot ask questions that may relate to genetic information. So anything family related, anything disability related, why didn't you get it? Well, I have a heart condition, or I have whatever. You can't ask those questions, or it may violate your employee's rights, or you have to make sure the person that's inquiring is protecting that information and not sharing it with the general public. Number four, I think, is a waste. That's why you see how little it is. Question was, how do you get the EUA, which is the emergency use authorizations for getting the first vaccines? And it says go to the FDA because they're the ones that control it. If that applies to you, you probably already know you're a first responder or a medical facility. That's where you have to go to get the EUA for the first distribution. Second distribution, you'll see here in a little bit, is supposed to go out to the nursing care facilities, to residents that are at high risk, and so on. You'll notice on here, I've bolded that it's K9 because we've moved down to there before I go back to 7 and 8. I'm sorry, 5, 6, 7, and 8. So 9, does asking an employee the pre-vaccination screening before administering it implicate GINA? The answer is yes. Then it says, and this is where I was like, why not put you're burying the lead. Why not put this up front? It literally says, if the pre-vaccination questions do include questions about genetic information, then employers may want to request proof of the vaccination instead of administering the vaccine itself. The reason for this is the EEOC doesn't have a clue. None of us do, because they're literally building these questions as the vaccines are being trucked around the country. So nobody knows what all of the pre-vaccine questions are all going to be for the general public. So basically what they've come in and said is, hey, how about you don't ask anybody anything? How about you hire an independent send them to an independent third party to get vaccine. Once they go to the independent party, then you don't have to worry about it. All you're doing is asking for the proof of it. So the EEOC kind of punted on this and said, don't ask, because you might be getting genetic information that's illegal. You might want to send them out to a third party. That doesn't really help those of you that need it right now, but that's kind of what they're recommending. So number 5, disability vaccine concerns. Now these 3 are where the crux of all of this comes in. So the big one here, K9, is don't do it yourself, send them out. That's really what the EEOC is saying now, because that way you don't have any of the pre-screening questions. You don't have to worry about genetic information. You don't have to worry about disability information. And then the questions come in. What about religious? What about pregnancy? What about disability? What about age? Well, they have great news for you on disability, which is number 1, you have to demonstrate that it is a requirement that an individual shall not pose a direct threat to the health or safety of individuals in the workplace. Great. Well, that's what our CDC is saying too, and so that helps. Then it says, however, you have to show it's a significant risk of substantial harm to the health or safety of the individual or others that cannot be eliminated or reduced by reasonable accommodation. Let me repeat that. That cannot be eliminated or reduced by reasonable accommodation. Problem with that is, what does that mean? And what is a reasonable accommodation once a vaccine is available? They went down through and they listed, there are 4 factors. The duration of the risk. It's a pandemic. Nature and severity of the potential harm. It's a pandemic. The likelihood that potential harm will occur. It's a pandemic. And the imminence of the potential harm. It's a pandemic. I don't know why they listed all that. They could have just said, we find that it's a pandemic. But then you have to show that they will expose others to the risk of getting the virus at the work site. And then they put this little caveat at the bottom. Can't take any action unless there's no way to provide a reasonable accommodation absent undue hardship that will eliminate or reduce this risk so that the unvaccinated employee does not pose a threat. If there is a direct threat, the employer may exclude the employee from physically entering the facility, but then they say, but you can't fire them. The only way you can fire anybody, the only way you can lay them off, the only way you can figure out that this person is absolutely not able to continue working is you can't do remote work. They've run out of FFCRA, they've run out of the EFMLEA or the FMLA, that there's no other way for you to figure out any way for them to do anything. Then and only then can you take an adverse employment action, and then you better document. Then it talks about at the bottom, and this is really critical. I've talked about this before. I don't know how many of you realize this, but you as an employer have an affirmative obligation to inquire of your employees. So even if the employee doesn't come to you and say, hey, look, I think I need time off because I'm hurting, I'm sick, I'm whatever, you have an obligation to look at them and go, okay, let's meet and confer. Let's talk about this and figure out what options are available. So this is reminding you, you have that meet and confer obligation, It's very troubling right now, though, because how do you know what a reasonable accommodation is? And how do you know whether this is going to be too burdensome? Because we've had the EEOC announce all kinds of leniency on reasonable accommodations and when those will lift and whether it's really financially viable and so on. So this is kind of dicey, especially if you're in HR. Then it says, and this is what frustrates me too, because as you saw, the EEOC website has crashed, but they say, hey, make sure you keep up with all the websites, CDC, OSHA, EEOC, all the different things, and it's your obligation to verify it. Well, if you look at the CDC website, and I sent someone from my firm to that website, said, hey, let me know what the updates are since our last meeting. He came in and he said to me, there's no way. Have you looked at their website? And I was like, oh yeah. And he said, there are literally like 75 different updates in the last 2 weeks. And the updates are silly. It's like they have a breastfeeding update, not silly at all. But then they have a breastfeeding update. Then they have another update to the breastfeeding update. Then they just republish it just in case you didn't see the other three. Well, they've been doing that with everything. Now, I use that one as an example, but they literally are safe work environment, safe work environment again, safe work environment again, and they don't tell you what's been updated. It just says that here it is as of December the whatever. So the CDC, you're having to keep up with it because the EEOC has now made that law. You have to keep up with the CDC, OSHA, any other federal laws, and make sure that you're in compliance. So make sure you document your meetings, make sure your managers are trained, make sure your HR department is aware. They continued, and this is where it gets really cool because they really are foolish. I'm going to be very kind in what I say. So K6 is religious belief. Number one, don't ask. You should basically assume that somebody has a pretty strongly held belief in whatever their belief is, because religious is not something you should ask about. So basically, don't ask. If they say they have a religious belief that makes it so that they can't take the vaccine, you're not supposed to really press a whole lot. You can, and it tells you how, but it basically says, hey, our guidance is basically don't ask because you should just believe that somebody's religious beliefs are what they say they are. Then it says, if the person says they have a religious belief that they can't take the vaccine, then you really can't force them to take it. So what do? It kind of punts and says, go back to the disability, and you'll see that here in just a second. What if you can't accommodate due to disability or religion? But you, under the religious, this is the direct quote, and that's why I put it in there. You have to give anybody who has a religious belief that they should not have this vaccine reasonable accommodation, quote, unless it would pose an undue hardship under Title VII of the Civil Rights Act, i.e. that it would be more than a de minimis cost to you to give them some kind of religious accommodation. I see this becoming a huge hotbed for lawsuits, and they gave us no guidance on it. Then they ask down here, what happens if an employer cannot accommodate due to disability or religion? And the answer is only if you cannot accommodate, there is no reasonable accommodations, only then would it be lawful for you to exclude the employee from the workplace. And by the way, you can't remove them if you remove them unless there's absolutely no remote, no FFCRA, no EFMLEA, no other leave that's possible, no other accommodation. And they've actually talked about maybe you should put these people in a separate room. Maybe you should have these people just socially distanced. I don't know how you're going to do that if every single person in a facility, one, you're already limited to 50% capacity, then everybody says, I'm not taking the vaccine. How are you supposed to do that? And how are you going to pick between them? But they gave zero instruction, even though this is a pandemic. So it's really kind of frustrating. Then they talk about GINA again, and they talked about does it trigger GINA if you require them to have proof of a vaccination? Short answer is no. But if somebody says, no, I didn't do this, so why didn't you do this? What steps did you take? If you start asking any of that, then yes, it may be both ADA or genetic information, because they may say, well, yeah, my family has allergic reactions. So we're back into the circle. They bounced around with all of this, and so it's created a lot of frustrations. Here's the kicker, though. What have they told us all along? The biggest population that is subject to this whole pandemic are people over the age of 50, 55, 60, 65. They bounced around with different ages, but the older you get, the worse it is. So, of course, they're going to come out with these questions and give us guidance on what to do with people who are in the ADEA or the Age Discrimination Employment Act, right? They're going to tell us how to protect those people, or what you can and can't do, what reasonable accommodations you can have, because, of course, the EEOC is on top of this, right? No. So there's no ADEA, there's no age-related discussion, there's no age-related limitations, no guidance for you on what you can do to omit people from the office if they don't take it, how you can use that to require other people to take it, or why you can't social distance. Literally not one reference to age. You have religion, you have disability, you have GINA, you have vaccines. They completely omitted the entire population of age discrimination. So good luck figuring that out. I think we'll get more guidance coming up. CDC came out with guidance. Yes, I scrubbed through it, removed the other 68 ridiculous updates, and I found 2 that I think you need to know about, actually 3. So they came out with a new guideline that says your typical isolation discontinuation, in other words, your quarantine, is now 10 days, not 14, or 24 hours since you had no fever without fever-reducing drugs. Doesn't really tell us what they're thinking and why, but they keep changing it. I told you what it was before, so I thought I'd let you know what the newest is. Then they came out with frequently asked questions about the vaccine. Right now, every vaccine but one, and it hasn't been approved yet, requires 2 shots. You still have to wear a mask when you're getting the vaccine and after you receive the vaccine. Why? Because they still don't know whether you can, even if you're vaccinated, whether you can expose someone else to the disease. There's no cost to anyone who is an American citizen. However, facilities can charge an administration fee. They don't say what that is, other than the person giving you the shot. They don't say how much it'll be. Distribution is first to first responders. Second will be to the long-term care facility residents. You still may need a vaccine even if you've already been exposed previously, because they don't know how long your immunity from having been exposed previously will last. Even with all other measures, a vaccine is still required. Yes, that was a frequently asked question. They're trying to stop the pandemic, so it doesn't matter whether people are wearing masks, doesn't matter whether they're socially distanced. CDC says we still need it. Evidence does not exist to determine how long safety measures will be needed. They said that because they think this is going to continue through the summer next year with mask mandates and so on. They don't have a clue how long it's going to take. Flu vaccine does not impact COVID. However, they are recommending that you do both, because it may impact the severity of your COVID symptoms if you don't take the test, if you don't take the vaccine. I'm not being political about vaccines, so I'm not going to tell you whether you should or should not. That's up to each one of you individually and your doctors. There is no knowledge yet as to how many people have to be vaccinated before they start herd immunity. They did mention that herd immunity does exist, which is kind of surprising, since right before November, they were saying, CDC was saying they didn't believe in the herd immunity. Now they say that it does exist, and they'll let us know. So there's that. The next update from CDC was about, whoops, sorry, I have no idea how that happened. Vaccines. There is a severe allergic reaction. No, I'm not your doctor. No, I didn't stay at a Holiday Inn Express, but I thought I'd put this up there because this was yesterday. actually Saturday night late. So if you need to get the vaccine, EpiPen with you, or make sure that people have it, because there are some people that are having an extreme allergic reaction. They're recommending anyone with a severe allergic reaction to any of the vaccine ingredients should not take the vaccine. Look at the other ones and see what ingredients they have. If you've had a strong allergic reaction to other vaccines, you should ask your doctor. If you have a history of just having allergic reactions to vaccines or injectable medications, you can still be vaccinated. If you have a history or family history, talk to your doctor, but you may still be vaccinated. So you see all these on here. That's up to you if you need to look into that or you need more information. It's on the CDC website. Make sure the one thing at the bottom is the critical one, because we just don't know. And I see the Brad Patrick comment. I was just being sarcastic about Russian hacking on our website. Make sure your vaccination providers have all of the appropriate medication and equipment, EpiPens, antihistamines, stethoscopes, blood pressure cuffs. They recommend you be there for 15 minutes if you're a normal patient, 30 minutes if you typically have allergic reactions, so that you don't end up being sick. All right. I wish I had more of an update for you on this, but this is the most that's out there, because, and this is bizarre to me and probably to Congressman Barr and other people as well. Believe it or not, they're going to be voting on this, or they are right now in the Rules Committee starting at 8 o'clock this morning. By noon, it's supposed to be to the Senate. They're voting on a bill for $900 billion that nobody has seen the text of. I heard a commentator this morning making a point that this makes the leaders of both the House and the Senate the most powerful people in the entire world, because no one that's voting on this has seen it. No text is out there. It's all just rumor. It's all just what people have said. I went through and I found several sources, tried to go through my other sources to verify. This is what I do know. Last night, they supposedly reached a final consensus relief bill. It lifts some money out that was in the previous one that wasn't spent. That can't be spent by the banks. They had about $500 billion that wasn't spent. Supposedly that's been pulled. Every person will get $600, not $1,200 that was out earlier this year, as long as you make less than $75,000. It does not talk about being graduated yet. I don't know whether it will phase out at $93,000 like the other one did. Couples, if it's $150. They also don't talk about, this says it's for adults and children. It does not talk about, well, if I have an adult, a child, and we make $160,000, do I get to divide that by 6 to get under the 150? Or is it once me and my wife make that much, doesn't matter whether my children are there or not, they don't get any money? That's not yet out there, but it's $600 per person, not $1,200. Unemployment benefits are $300 per week, not $600. That's in addition to whatever your state is. Kentucky maxes out at $552, so that would be $852 for Kentucky at the max. $300 minimum. We'll have to see what that is because I haven't seen it yet. PPP, which affects a lot of you on the call. There's apparently, supposedly, maybe, I don't know, $300 billion allocated to small businesses in additional funding. Couple of caveats here. They have said that they're going to clamp down. They want to see how it has impacted you in your tax returns in the second and third quarter of 2020. In other words, they're going to verify that you actually need the money, because a lot of people took the money without needing it the last time. I don't know how they're going to do it. I know the SBA is going to come out with its great and wonderful rules again, and then they'll have a new application again. Then I'll be walking you through the application again next week or the week after, trying to explain all this, because it's another bureaucratic red tape fun time for us to figure out what we're doing. So that's what's going to happen. Apparently the hardships will be documented. The good thing for everyone, and I have not seen any of the text, so I can't tell you what it has in it, but supposedly it includes tax relief by forgiving the payroll costs and other expenses that were allowable as long as your loan is forgiven. So if you remember the end of November, I think it may have been the December 3rd update, I told you the IRS and the Treasury basically said, we don't care what Congress intended. This is taxable income. You're going to get taxed on your payroll. You're going to get taxed on your other expenses. And we don't care what Congress thought. Well, supposedly it's being built into the text that will give you forgiveness, so you'll be able to double dip. That's the only way I can put it. I don't know how else to explain it. So basically, I gave the example at the beginning of December. If you had $100,000 in payroll costs, you paid out the payroll at $100,000, but you just received a free grant from the government. You have to pay your taxes on it. So you paid out $100,000, but you really only netted $66,000. Well, now what they're saying is we figured out a way that it will be all forgiven so that you can pay out the payroll taxes or payroll costs and not have to pay the 1/3 or 32% business tax. So that's where that is. Stay tuned because I don't know what the text is on that. The last thing that they did was they issued a lot of money for schools, $82 billion. Healthcare providers, I didn't get the total amount. Renters, they're going to be protecting those. There's been some discussion they also had for people who are in the business of renting, that they might have relief for those, but I haven't heard of any of that. I just heard rumor of it. Details are still coming out. I don't know what we're going to see. There's a whole lot of craziness going on with what's in this $900 billion, how long it'll last, what else they're going to do, and so on. I've gotten some questions lately. We're on the question and answer. I've gotten a lot of questions lately about the contact tracing and what you're supposed to do with that. What are we supposed to do with how long people are supposed to stay out and so on. My recommendation is follow the CDC guidelines, do your own contact tracing, because by the time the local government gets to you with their contact tracing, it's literally 2 weeks in, and by when they give you a call 10 days to 2 weeks in, the person's already back to work. So do your own contact tracing. Try to do the best you can. Document people coming into your facility. One of the questions I got was about last 2 weeks ago, I made the comment about going to a distillery, and they literally took my email and information. There's a lot of that recommendation to have people's phone numbers or text and get that information so that you are documenting people that have come in. Otherwise, how are you going to show the government that you actually traced people? Now, I don't want you shut down because you didn't do that. Now, if you are a grocery store or a Marshall's department store, anything like that, I don't know what you can do because people come and go in your facility all the time. FFCRA, that ends on December 31st. I have no clue what they're going to do with that. I have not heard a word about whether that's going to be extended into 2021. I don't know what they're going to do. This is all a nightmare. I had promised you that there would be an answer sometime in August, September, October, and November. And Congress didn't do it, and it was very frustrating. If you listened to any of the news, there were some comments made by a certain leader that basically said, well, now we can do it because there's a change in administration, so we can go forward. That should never have been, even if that was reality, which we kind of knew, that should have never been stated because people's lives and livelihood are at risk. So that's where we are. I know there are some questions. I think we should roll on, and I'll try to answer them as we're going through the rest of it, Lyle, unless we need to address any of them right now.
I don't see many right now. Do you? Let's see, 6. They just popped in, so maybe we have some.
I see them. Most of them are about the FFCRA and the return to work guidelines. The 10 days, that does apply, but I don't know the CDC has been bouncing around with what they mean. They do say right in this guidance that may not apply if somebody is immunocompromised. So if they're not healthy, they could still distribute the disease after 10 days. So whatever you do, document what your basis was for doing what you were doing. Because the CDC is all over the map. Local, state, they're all over the map. Just make sure that you document everything that you can. And I've read about the nonprofits. One of the questions was, are 501c6s included? As you know, they were not included in the past. Those are your trade organizations, things where tax donations are not tax deductible. I've not heard whether they'll be included, but I do see the comment that Angie says she thinks that they are. Fingers crossed for those of you that are 501c6s. I'm hoping that some of the money will be outside of just the 501c3s. So that's where we are.
All right. Well, let's keep the questions flowing in. If we get some more, that'd be great. We had a lot of stuff to pitch because we weren't sure whether all this was going to happen or not. So we aren't going to be able to cover all of it, but Allison and Autumn and Chase are ready to go with some of it. And I'm going to ask them just to hit the big highlights. And do you all want to do your survey first or do it later?
Yeah, I think we should do the survey first.
All right, we got some questions to ask the group here, and it help us figure out which one of these things we ought to focus on most. We will give you all the slides, and I think you'll find it interesting. We actually went back to all the past sessions and pulled out the things that are most important that are still really relevant, and they're good reminders of things. But let's go. Let's throw the questions out there. Let's answer them quickly if you can, and then we'll move right on to some more presentation before we sign off. By the way, I'm monitoring TV and I don't see anything final yet.
And the poll's launched.
All right. Shall we read these to make them go faster?
Whatever you want to do, or Allison, if you want to read them.
Right, I'm happy to. During lockdown, what has been your go-to streaming service? So we've got Netflix, Hulu, Apple TV, and Amazon Prime. What do you hope Santa brings you this year? We've got a stiff drink, a soundproof room for my kiddos so I can have a moment of peace, a better internet connection for streaming all the things, an extra day off at Christmas, or more pajama pants for those work from home days. We have number 3. Are you willing to take the COVID-19 vaccine? So yes, no, unsure. What service do you use the most for your food delivery? DoorDash, Grubhub, Kroger ClickList, and you make the food yourself, or you send your kids and spouse to pick it up? And have you had a COVID test this year? Yes or no? Number 6 is, do you have music playing in your home office? So classic rock, the 80s, pop rock, country, jazz, or you like it quiet? Have you had positive employees at your workplace? Yes or no? And if yes, what percentage of employees would you say have had COVID at some point this year? There's a lot of different percentage options there. And what's your least favorite thing about going into a new year? So we've got signing everything with the wrong year for the first quarter, not accomplishing your New Year's resolutions, returning to work after the break, removing all of the holiday decorations, or 3 more months of cold weather. And what are you most looking forward to in 2021, aside from the obvious regarding COVID improving? So any form of in-person interaction, even a DMV trip will do. The Summer Olympics, hopefully. A proper vacation in the sun, and it no longer being 2020.
There it is. Some of this is for sons, some of it's for fun, some of it's to give us some guidance on what we ought to focus on going forward.
Stiff drink and no more COVID.
Sounds good to me.
Hey, Jim,
Right.
while we're waiting for people to answer, I just thought of a question.
Hey, wait, before you say that, I didn't see an all of the above on the stiff drink one. Yes, sir.
I was just thinking, this is a little bit maybe premature, a little bit of hypothetical, but right now we know that 2 of the vaccines have 2 different dosing regimens at 21 days and 28 days apart. Others, obviously, when they hit the market, different dosing protocol. But there are already people that are experiencing slight symptoms of like fever, fatigue, chills, body aches, etc., for a day or 2 after. So let's say we encourage our employees to go get vaccinated. What are we going to do to give them time, perhaps, to recuperate just from the vaccine itself?
You remember we talked a little bit about that last week, because I said one of the issues is if you force your people to take it and somebody gets sick, are you going to pay them because they're sick or where they have symptoms? I expected the EEOC to kind of weigh in on that, and they didn't say a word. And it's the EEOC, for the things that they like to throw out there and force people to do, for them to not address what to do with people who are elderly, and by that I mean anybody over the age of 50, me too, because that's the age group that they say is more at risk. They didn't cover any of that. They didn't cover what to do if people are sick from the virus. I think if you mandate it, you better let people stay at home if they're sick, because I can see some lawsuits coming out of that. So that's just my point. And you're going to see more guidance in the next few days, because the vaccines are starting to roll out. The thing I've been worried about is people getting both vaccines. What impact is that going to do to people? Because I can see somebody thinking, well, I'm going to get both because this one may not have the same protection as the other. The numbers I've heard are 92 to 95% effective. Well, that leaves 5 to 8%. That's scary too.
All right, Allison, here's the results.
All right. Let's see here.
Wow, a lot of people have had employees, positive employees in their workplace, 85%. Go ahead, Allison, what are you going to say?
Oh, nothing. I was just going to comment that it's, what do you hope Santa brings you this year? Most people want a day off at Christmas, but the next was a stiff drink. I thought that's.
I think I influenced that a little.
I'm surprised. Let's see, 38% would take the vaccine. Boy, a lot are no or unsure. That's amazing. I hope this is helpful for people that are looking at the results, just because it's kind of cool to know where everybody stands. I'm shocked that only 58% of us have had tests, since I've had 8 of them, but I've been on the move some. So, any other observations from the group?
I think it's great that most of the people who have had positives, it's been less than 10%. So everyone
That is
seems
really good.
Really trying their best to slow the spread and do what they need to do. And we're seeing the results.
Yeah, and I'd venture a guess that they probably didn't get COVID at work, did they? Because they've been following the healthy at work guidelines.
All right, let's jump in and share some of the other things we wanted to share with people.
Okay, so real quickly, so like Lyle said, we're trying to just recap some of the most valuable and still applicable takeaways from our sessions this year. Of course, we're grateful for every guest that we've had, but you'll notice some of the speakers or some of the sessions are skipped in the slides. We're only going to talk about 4 of them today, but some of the slides are missing speakers or guests, and that's just because guidance has changed or the takeaways are too specific and they're no longer applicable, or they were really of that moment. So this will hopefully help direct you to any of our slides that you're trying to find or any of our past sessions. But just a reminder, you can access them on our website under resources and COVID resources. Every session that we've done, the PowerPoint and the recording is available there for you. So feel free to check back, and then I'll turn it over to Chase to cover one of his.
Yeah, I think we're skipping already over to week 7, right? So
yes.
I'm not steering the slide deck. So 7, go back one more. 7 is just a reminder that was our very important Governor Bashir guest. He was our guest of honor that day. But that was the introduction of when we were doing the phased business reopenings. But the biggest takeaway there is the healthy at work guidelines. They're still applicable. So that really hasn't changed in the last 7 months. So hopefully people are still doing those things, but just wanted to reiterate the importance of that, those measures and to protecting people. And then just, the documentation of who's coming in and under your building is so immensely helpful since we're all having to contact trace ourselves, it seems like here lately. So just wanted to reiterate that for people.
Perfect. And then if we can go ahead and skip to week 11, I will talk about that one really quickly. So we had 2 great guests on that day. We had Beth Davison from the Kentucky Chamber Workforce Center and Brad Patrick, who's on here again now. But Beth talked a little bit about those groups that were most impacted by COVID and the loss and, the loss and suspension of some jobs. And that's a group that's still really affected today, probably the most affected people, those who make low wages, those who are part-time, young women and minority workers. So just kind of want to remind everybody to try to help those groups whenever possible, and then reshare the link to the Second Chance Employer website in case you're interested to post jobs to that board or to sign up to be a Second Chance Employer. And then Brad Patrick gave us some really positive stuff to focus on as we kind of looked forward to the challenges. So reminders to focus on positive opportunities. Make it your goal to eliminate or minimize uncertainty and build trust. Of course, as we all know, you can't possibly eliminate uncertainty right now, but trying to make your goal to help wherever you can, however you can, build that trust so that when things are uncertain, they still feel like they're on level ground is really helpful. Help organization confirm their values and commitments or establish new values and commitments. Begin with the future state in mind and plan from today forward, and then focus on the mission critical work. So stop, start, continue, and delay. Those are things that are still really helpful for organizations to focus on regardless of what type of challenge they're encountering. Then if we can skip to week 13, please. Thank you. So I also just think it's important to revisit the workers' compensation.
This is Laura, may I help you?
Hi,
Sure.
Laura.
Would you like to do this slide? So week 13, we talked about workers' comp and just wanted to kind of revisit 2 key things that Timothy Feld talked about. He's from KEME. The KRS statute that talks about how injury doesn't include the natural aging process or communicable diseases unless the risk of contracting the disease is increased by the nature of the employment. And then COVID diagnosis is presumed work-related if the employee is a first responder or medical personnel, but the burden of proof would shift to the employer to prove otherwise. So I think it's really important just to check back in with your workers' comp carrier if you haven't in a while, see if anything else has changed, but those are things to keep top of mind. And then now I think we can skip to week 26. Thank you.
Oh, I like this guy. Eric is great.
Yes. In week 26 or phase 26, we had Eric Ellis, president and CEO of Integrity Development. He talked a lot about idea and diversity. So he gave us this great wheel that talks about the different factors that play into diversity and different factors that make up a person. So there are some great slides on that if you want to go back and reference that on our website. But just key takeaways are focusing on sustainable inclusion. So not just one-time efforts, but long-term sustainable efforts. He also gave us a formula for long-term bias reduction, and that was increase awareness, increase empathy and concern, and develop strategies to reduce bias. And there's a lot of great content on those slides about that.
All right, so as we said, we'll send out these slides like or we'll make them available on the website like we always do, because we did not cover all of them, but we really were trying to keep it to within an hour because I know Lyle has one more thing he wants to address before we sign off.
Yeah, thank you all, man. Okay, I know you've got a lot more great material in those slides, so I hope people take advantage of them and take a look at them. We covered a lot of good stuff over these months, and it's been fun to be partner with so many people that are on this call. We really appreciate your signing on with us, and We hope that all we've shared has been helpful. A lot of you have really encouraged us, so we've stayed after it. We're going to continue doing these next year. Right now, we're looking at the next session we're going to put on the calendar is January 11th for another Monday morning session. If a lot of stuff happens before then that we need to set up one for, we'll do that. We'll just announce it and get people together. But we also want to tell you about one other thing we're going to do. And it's going to be before that 11th date. It's going to be on January, what is it?
7th.
7th, yeah. The 7th day of the year. We're going to do an afternoon session, 3 to 5. And we're calling it Raise and Praise. And we're going to do some things to introduce you to leaders in our community, people that have helped us out with these calls, people that we're closely associated with. And I think you'd have a ton of fun joining us for this thing. We're going to have some music. It's going to be a positive experience. We're going to talk about what has changed. What have we done that makes us successful now that we weren't doing a year ago at this time? How have we adjusted? How have we shifted, refocused? And we're going to hear that from a whole lot of people that are real leaders in our community and across the state. And I think you'll get a kick out of it. We'll send you some information about it. We're calling it Raise and Praise because we're going to talk and we're going to raise some money for organizations that are really making a difference, that are really helping people right now. A lot of you probably know that at Hannah Resource Group, a lot of our funds go to support those things. We're already supporting a lot of these groups, like Nourish, one of the organizations that we talked about earlier, or God's Pantry, or that are feeding people, or other folks that are doing work helping people find jobs, and Habitat for Humanity is what I'm very close to. It's putting a lot of people in houses and helping fix their houses and make them more, affordable, more energy efficient. So I think it's going to be a blast. We look forward to having you join us. I think you'll get a kick out of it. And we wish you a Merry Christmas and a very Happy New Year. Let's be safe. Let's stay healthy. And we'll look forward to talking next year. If you have questions between now and then, just pick up the phone and call us. Our numbers are out there, and we'd love to talk. Anything else? Troy.
Just wish everybody a happy holiday.
Okay. Brad.
Happy holidays, everybody.
All right. Jim, final word.
I have no other words. Stay tuned.
Unbelievable. If Jim is speechless, we need to sign off. Everyone take care. God bless you. And we look forward to talking in the new year.
Thank you all.
If you want to hang on right now for a few minutes, I'll be here.